As we all know, the skin is the biggest organ in the human body. And any inflammation or a problem that occurs in the skin can be annoying because it creates a feeling of insecurity toward the way we look. In this study, I looked at 3 bacteria, S. epidermis, S. aureus, and P. acnes, which they play a big role in common skin problems like acne, eczema, and skin boils. They usually do that by releasing toxins. An example of that is P. acnes. P. acnes usually gets triggered by excess sebum production and inflammation. When P. acnes is triggered, P. acnes produces lipase and it digests sebum and produces fatty acids. These fatty acids produce a cascade of chemical events that lead to inflammation. The inflammation is usually epidermal. Using chemical creams can be bad because it gets rid fully of the bacteria, and that is bad because these bacteria play a role in the skin flora. In addition to that, protecting the skin from UV light and UV damage can reduce inflammation caused by these bacteria. In this study, I tried to create a formula that contained red raspberry seed oil and neem oil, which will create antimicrobial, antioxidant, and SPF effects. Using minimum inhibitory concentration, I tested different concentrations of oils to determine which concentration slightly inhibit these bacteria without killing it fully. And the concentrations that were tested are 20, 30, 40, 50, 60, and 70%. And to support these results, a disk diffusion test was created at the concentrations starting from 1% up to 70%. As shown in figure 2, we can see that 70%, which is the highest concentration tested, had more antimicrobial effects. And also, as shown in figure 1, using disk diffusion, 70% also had more antimicrobial effects for both oils. However, red raspberry oil had more antimicrobial effects compared to neem oil. Also, low concentrations like 30% also had antimicrobial effects. So a formula that contained 40% red raspberry seed oil was created. The formula was a body butter, and there were 2 body butters that were created. One body butter contained 10% zinc oxide, and the other body butter did not contain any zinc oxide. Both formulas were tested for antimicrobial effect using MIC and disk diffusion. As shown in figure 3, both of the formulas did not have any antimicrobial effects because the viability of the bacteria is higher than the positive control. Using DPPH test, it was found that all concentration had an antioxidant effect lower than the negative control, which indicates that there wasn't any antioxidant effect. To test for SPF, the formulas were diluted in 40% reagent alcohol, and the absorbance was read at 5 nanometers intervals from 290 to 320 nanometer. And it was found that both formulas did not have any SPF effects. And that can be due to over diluting the formula. In addition to that, Shea butter is very hydrophobic, and most of the formula might have been lost due to filtration. However, it was found that both of the oils had antimicrobial effect, which can be used on the skin to protect the skin from the bacteria.